Recording in
graduate
progress.
of the University of the Philippines with a degree in Bachelor of Arts in Social Sciences. She also studied the master's program for business administration at the Ateneo de Manila University. She is also an active member of the Management Association of the Philippines, also known as MAP. Deliza is one of the MAP Next Gen CEOs in the SGV MAP Next Gen CEO Transformative Leadership Program for CEOs under the age of 50. So without further ado, please welcome Ms. Deliza Rideloso.
Thank you, Rose. Thank you very much. So good morning to everyone. I don't know if you can see me yet, but I'd like to thank all of our friends, our guests, our family, everyone that's here. And of course, I'd like to thank my colleagues at Pacific Sun and at Pacific Office Solutions for joining us this morning. So welcome to all of you that are here. I'm really happy that you're here. This is going to be a great discussion and a great talk by Dr. Marissa Lim about why we should get vaccinated. So today we're going to share a live webinar. This is being broadcasted through YouTube and through Facebook. And this webinar is about why we should vaccinate, vaccinating you against COVID-19. This is a really important topic that many people are scared to discuss or who refuse to get vaccinated because maybe they're worried about it, or people who just don't want to take the vaccine at all. So we're here to have this discussion with you so that maybe you might have some questions, or maybe you need to hear what Dr. Marissa needs to say. And we hope that this will help you maintain your decision to vaccinate if you've already decided to vaccinate. And we hope for others that this will help you consider vaccinating against COVID-19, because COVID-19, the pandemic, has really made a huge impact on us in terms of the way we live. Of course, there are some the good effects of COVID-19 where we've learned to spend more time with our families, and the environment has renewed again. But of course, the other things is a lot of people have died. Millions of people have already died because of COVID-19. And some people don't believe it. So we want to tell you that COVID-19 is real. And one of the ways that we want to tell you that COVID-19 is real is we want to share a true life experience of one of our colleagues at Pacific. It was a really sad situation that one of our own had to experience this COVID-19 in their family, and we want to share this with you. So please watch our video.
Hindi ka ba nagtataka? Bakit nga ba ngayon ay nakasailalim pa rin ang ating bansa sa community quarantine? Gaano nga ba kadelikado at seryoso ang kumakalat na sakit at tinawag na itong pandemya? Nagsimula ang aking kwento na makatanggap ako ng tawag pagkatapos ng aking shift. Wala nang ospital dito sa Maynila, hindi na nag-a-accommodate, punuan na. Kung wala nang ospital ang pwedeng mag-accommodate sa Manila, maaaring pwede pa sa karatig nitong probinsya. Nakahanap kami ng ospital, ngunit binigyan lamang siya ng gamot at inabisuhan na kailangan na nga niya ng tulong sa paghinga. Kami rin ay nasabihan na ang kondisyon niya ay dapat na palang nakakonfine. Ngunit marami na raw masyadong COVID-19 patients sa loob. Mas lalo lamang lalala at magiging kritikal ang kondisyon niya. Kaya naman, nagsuggest na lamang sa amin na iuwi namin ang pasyente at pumirma ng waiver na kami ay voluntaryo nagpresenta na iuwi na lamang siya. 2:00 ng madaling araw, nakatanggap muli ako ng tawag. Kailangan na daw ulit siyang isugod sa ospital. Bumalik kami sa naunang ospital na tumanggap sa amin, ngunit sa pagpirma namin ng waiver, hindi na pala maaaring ibalik ang pasyente. Nagbigay lamang sila ng paunang lunas at kami ay naghanap na ng panibagong ospital. Nagsimula kami sa 3, 4, hanggang sa 8 malalaki at prominenteng ospital. Ngunit hindi kami nito tinanggap. Halos pare-pareho ang dahilan. Wala na daw isolation room. Nakakawala ng pag-asa. Sa pangsyam na ospital, tinanggap siya ngunit nasa tent na lamang dahil sa hinaharap nating shortage dahil sa pagtaas ng kaso ng COVID-19. Mula ospital hanggang bahay, 3 malalaking oxygen tanks ang tangay namin para masulit ang haba ng biyahe. May kamahalan ang bawat tangke. Ang mahal palang magka-COVID-19. Baka sakali din kami sa walang kasiguraduhan at hindi pa aprobadong gamot. Ganoon na lang umabot ang aming determinasyon, gumaling lamang siya. Ngunit hindi na niya inabot. Muli kaming nakatanggap ng tawag. Wala na daw siya. Ni hindi namin siya nasilayan sa huling pagkakataon. Kahit picture o huling sulyap sa muka, hindi na kami pinayagan. Hindi namin alam kung saan niya posibleng nakuha ang virus. Masyado itong mabilis. Hindi pala porkit bata ka, mabilis kang gagaling sa COVID-19. Ang pagiging tapat sa kung ano ang nararamdaman nating sintomas ay dapat hindi pinagwawalang bahala. Mahalagang ibigay ang tamang impormasyon sa doktor tungkol sa tunay na nararamdaman. At huwag maglihim para lamang iwasan na tayo ay mabilang sa COVID-19 cases. Sa ganitong paraan ay maibibigay ng doktor ang tamang medikasyon na ating kailangan. Some people are lucky and some people are not. That's why those who get it mild should be thankful they got it mild. Sometimes, those who got mild COVID send the wrong message that it is no big deal since they've recovered easily. Remember that people don't get to choose if they get mild COVID or not. Tayo'y mag-ingat at ingatan ang ating pamilya. Huwag tayong matakot sa diskriminasyon kapag tayo ay nag-positive sa COVID-19. Focus tayo sa pagpapabuti ng ating kalagayan. Hindi ko inihayag ang aking storya upang manakot. Ito ay para pagpulutan ng aral.
We'd like to thank our Pacific employee who shared that story with us. It's really devastating that, that COVID hits our family like that. Actually, that particular employee of ours was actually questioning, is COVID really real? Until COVID hit his family. And the person in his family was only, I believe, around 34, 36 years old. She was so young. So some people are lucky and some people are not. So don't wait until you get COVID, or don't wait for someone in your family or someone that you really love to get it. Make the right choices as early as possible before it happens. Avoid this kind of situation. Do it for your protection. Do it for your family's protection. Do it for your loved one's protection. So again, thank you for sharing your personal story and letting us know that, COVID is real. COVID is real. So let's go now to our speaker. This morning, I am proud to introduce the much-awaited speaker for the morning, Dr. Marissa Elizabeth Lim. She graduated magna cum laude in BS Psychology from the University of the Philippines and finished her Doctor of Medicine. Dr. Marissa completed her residency in internal medicine and completed her fellowship training in nephrology under the Department of Internal Medicine at the University of the Philippines, Philippine General Hospital. She is currently taking her master's in physiology at the University of the Philippines. Dr. Marissa Lim is an active consultant at the East Avenue Medical Center, Diliman Doctors Hospital, San Mateo's Medical Center, Pacific Global Medical Center, and is a visiting consultant at the Philippine Heart Center. Before our speaker starts, I want to inform all the participants at this webinar that we have a raffle for audience participation. So we will draw 5 winners for 200 peso GCash prizes. So please try to listen as much as possible to Doctora's talk and have your questions ready. Each question is equivalent to 1 raffle entry. So you can type your questions in our YouTube, Facebook, Zoom comment section. So we will spin that wheel for the raffle. Everyone who asks a question will be on the wheel to win a prize, and at least you'll also gain more knowledge. Without further ado, I would like to introduce Dr. Marissa Elizabeth Lim.
Good day, magandang araw po sa ating lahat at maraming salamat sa ating mga partner na doktor at mga partner sa negosyo na nag-i-invite sa atin para mag-share ng mga momenting bagay tungkol sa COVID-19 vaccination. At ako po si Dr. Marisa Lim. Malaki din po ang aking pasasalamat para kay Dr. Rose Zamora. Isa po siyang infection disease specialist na tumulong sa akin para mag-prepare ng mga sharing na ito para sa inyo. So ngayong araw, hopefully masasagot natin ang tanong na, is it worth the shot? Pwede ba talaga tayo magpa-vaccine at sulit ba ito? So ngayon, for 30 minutes, inaasahan ko na matatalakay po natin ng mga updates tungkol sa COVID-19 in terms of numbers, ipaliwanag kung paano gumagana ang ating immune system o panlaban sa mga virus, ipakita kung paano gumagana ang mga vaccine o mga bakuna, ilista ang kanilang mga benepisyo or benefits, at sagutin ang mga tanong tungkol sa COVID-19 vaccines. So sa buong mundo, higit sa 100 milyon o more than 100 million patients ang nagkaroon na ng COVID-19 at mahigit sa 2 million ang namatay o nawala sa atin. Dito sa Pilipinas, nakakatrauma yung COVID dahil parami siya ng parami. Higit sa 1 milyon to date ang naging infected dahil sa COVID-19 and around 17,000 ang namatay. So ano ba yung alam natin tungkol sa COVID-19? Ang COVID-19 po ay isang respiratory virus na nag-i-invade sa ating lungs. So ito ay maaaring maging mild o para lang sipon o para lang flu, pero may mga bahagi o may klase ng COVID-19 na pwedeng nagiging critical or severe. So ito naman yung na-ospital, nakakabit sa ventilator, tapos ito yung nakakamatay. So, kailangan maproteksyonan natin yung sarili natin laban sa COVID-19 kasi madali ito makapanghawa. So, paano natin yun gagawin? So, pwede tayo makapagpanatili ng hindi bababa sa 1 metrong layo mula sa ibang tao. So, ako iniisip ko dyan, iisipin ko na may isang buong lechon sa pagitan naming dalawa para hindi ako makapanghawa, mag-face mask na nakatakip ang ilong at ang bibig at magsuot din ng face shield. Pero ang isa pang paraan para proteksyonan ang sarili natin, maliban sa tinatawag na barrier, ay ang acquired immunity. At ito ang tatalakayin natin ngayon. So, ano ang acquired immunity? Acquired immunity is yung nagkakaroon ng katawan natin ng panlaban sa sakit. So, halimbawa may virus like the common cold or sipon, meron pwede tayong ma-infect ng sipon o kaya chickenpox halimbawa. Tapos pag meron na yun, yung katawan natin, maaalala niya yung sakit na yun. Tapos magka-create siya o magkakaroon tayo ng mga panlaban laban sa virus. So, ito yung mismo nagkasakit tayo. Tapos, pag nagkaroon ulit tayo ng exposure or meron tayong katabi na nagkaroon siya ng sipon, halimbawa, common cold, hindi na tayo magkakaroon ng sakit na yun kasi protektado na tayo dahil nagkaroon na tayo ng sipon dati. Dahil dito, pwede nating hindi na makalat yung sipon and nagkakaroon tayo ng tinatawag na herd immunity. So, halimbawa, lahat tayo sa household natin, di ba? Meron nagkatrangkaso, tapos nagkahawahan lahat. Next time, pag dumating na yung trangkaso na yun, hindi na tayo magkakahawahan kasi kaya na natin siyang labanan. Pero meron tayong acquired immunity na nakukuha galing sa pagbabakuna or immunization. So ito, ang nangyayari naman dito is hindi talaga tayo nagkakaroon ng sakit, pero yung panglaban is nilalagay sa ating dugo para kung kunwari meron tayong sakit na parang na ma-encounter na parang ganun, hindi na malalabanan na siya ng ating katawan. Halimbawa ako, hindi pa ako nagkakaroon ng chickenpox sa buong buhay ko. Pero kung nabakunahan ako against chickenpox, tapos magkaroon ako ng panlaban against chickenpox, kahit na hindi pa ako na-infect nun dati, kaya ko na siya labanan. So, meron tayong tinatawag na natural response to illness. So, ang nangyayari halimbawa, itong mga bilog na to, yan yung mga sakit. So, pwedeng naglalakad tayo, sasakay tayo sa jeep. So, yung katabi natin, pwedeng meron siyang measles, o may flu, or chickenpox. Kung na-infect na tayo niyan dati, meron tayong antigen yung cause ng infection. Yan yung microorganism or yung virus. Pag na-infect na tayo niyan dati dahil gumaling na tayo at nalabanan na natin siya, nagkakaroon tayo ng tinatawag na antibody. So kung mapapansin natin yung antibody, specific siya or may nakatadhana na antibody laban sa isang antigen. So kung mapansin nyo, halimbawa itong measles, matulis yung kanya. So yung antibody niya o panlaban siya, makikilala siya kasi matulis din yung dulo ng antibody. Itong flu, bilugan naman yung kanya, yung sa surface niya o dun sa ibabaw. So yung panlaban niya na nandun sa katawan natin, bilugan din. Tapos ito halimbawa, chickenpox. So yung chickenpox na antigen or virus, square naman yung kanya. Yung panlaban natin sa katawan, square din. So kung mapapansin nyo, yung antibody ng chickenpox, hindi niya kaya labanan yung antigen na measles. Specific sila sa isa't isa or may nakatadhana na isang antibody sa isang antigen. Ang tinatawag namin dito is yung lock and key. Specific na may isang susi para sa isang lock. Parang ganun sila. Ngayon, kung may bago tayong pathogen or bagong antigen, halimbawa COVID-19, wala pa tayong antibody dyan tayo magkakaroon ng sakit. So ano yung alam natin tungkol naman sa bakuna or sa acquired immunity na immunization? Makikita natin dito na sa kasaysayan or sa history, yung iba't ibang sakit gaya ng diphtheria, polio, and measles, makikita natin that from the time of vaccination o kung saan nagsimula ang pagbabakuna, kumukonti sila. So makikita natin na mahalaga to sa ating kasaysayan at pwede natin to gamitin ulit. Paano gumagana ang bakuna? So, halimbawa, meron tayong disease-causing organism. Pangalan niya halimbawa, COVID. Ganyan. Halimbawa, COVID. So, yung ulo-ulo ng COVID, diba, square siya. Ang mangyayari, hindi naman kailangan na ma-infect talaga tayo ng COVID para gumawa tayo ng antigen para sa kanya. Ang nangyayari is doon sa loob ng bakuna, ang meron lang is mga pera-perasong COVID na square-square din yung itsura. So, yung katawan natin, akala niya siya na yung buo. So, gagawa na siya ng tinatawag na antibodies o panlaban na square, specific dito, sa mga pera-perasang to, pero kaya din yung labanan yung disease-causing organism. So, ang ginagawa ng bakuna is binabawasan nila ang chance na magkaroon ng infeksyon dahil tinuturuan nila ang immune system na makilala yung ating pathogens or yung mga sakit. Tapos, nagbibigay sila ng immunogen or specific type of antigen that elicits an immune response. Ang ibig sabihin nito, kahit na pera-peraso, i-excite niya yung katawan natin na mag-produce ng immune response o mag-produce ng antibody laban sa antigen. So, sa vaccine, wala pa tayo nun. So, gagawa ang katawan natin ng bagong antibody nang hindi tayo na-i-infect nung buong virus. So, paano siya ginagawa? Paano nililikha ang isang bakuna, inaaprubahan at pinaparami, no? So, yung Food and Drug Administration, meron siyang tinatawag na 3 phases ng clinical trials o matinding pagsusuri ng ating mga bakuna para siguraduhin na ang kaligtasan ng mga volunteers. So, yung mga researchers, tinetest nila yung mga bakuna sa mga adults sa first time. So, sa phase 1, halimbawa, ako yung gumawa ng bakuna, di meron na ako mga bakuna. Kukuha ko ng mga volunteers or yung mga excited mag-participate para makatulong, kasi sila muna yung babakunahan. So, wala naman sila ng sakit. Susubukan lang kung ligtas ba sila dun sa bakuna, gumagana ba yung bakuna, may side effects ba siya, tapos ano yung dami or yung dosage ng vaccine na kailangan ibigay. Kung makita na dito sa 20 hanggang 100 na kumalahok dun sa kumalahok sila dun sa phase 1 clinical trial, dadamihan na nila yung subjects. Subjects, ibig sabihin yung volunteer or yung nag-participate dun sa clinical trial. So, dito sa phase 2, mas madami. Tapos, titingnan nila yung short-term side effects. Tapos, kung kamusta yung nagiging response or yung nagiging reaksyon ng katawan natin laban sa bakuna. Ngayon, kung nakita dun sa ikalawa na ligtas pa rin siya, tapos mas madami yung benepisyo ng bakuna kaysa dun sa tinatawag na risk o yung chance ang magkaroon ng problema, magkakaroon na ng tinatawag na phase 3 clinical trials. So dito sa phase 3 clinical trials, daan-daan o libo-libo mga volunteer or participant or kalahok ang sasali. Tapos dito makikita nila, i-compare na nila or paghahambingin na nila yung mga pasyente na nakakuha ng bakuna tapos hindi nakakakuha ng bakuna. Ligtas ba to para sa kanilang dalawang grupo? Epektibo ba? Tapos ano ba yung pinaka-common na side effects? So yung FDA, ibibigay lang nila yung bakuna sa lahat ng tao pag nadaanan na lahat ng ito. Tapos yung mga bakuna, ginagawa siya in batches or lots. Tapos dito talaga minomonitor kung paano ito ibinibigay. Tapos sinisigurado na mga manufacturers o manilikha ng bakuna na ang mga bakuna ay ligtas, puro at walang at gumagana talaga. Tapos pag okay lahat nito, saka siya itutuloy. So, yun dati, bago ng COVID-19, 15 taon yung oras bago siya makaproduce ng bakuna. Kasi aaralin muna nila sa mga daga, mag-phase 1 hanggang phase 3, etc. Pero dahil sa pandemya at sa paghihirap natin sa COVID-19, nagsama-sama ang lahat ng kumpanya para immediate na ma-produce natin yung vaccine at from the time na nagkaroon ng COVID-19 until na-review siya ng FDA, nadaanan din yung lahat ng proseso, ano lang siya, 10 months hanggang 1.5 years total. So, nagtulong-tulong talaga lahat para mabigay sa atin ang bakuna para maproteksyonan tayo laban sa COVID. So, ano yung benepisyo ng bakuna? So, iniiwasan nito ang pagkakaroon ng malalang sakit, iniiwasan nito ang pagkakaroon ng clinical disease. Ibig sabihin nito, posibleng meron akong COVID pero walang lumalabas sa akin. At iniiwasan nito ang pagkalat ng COVID sa iba't ibang mga tao. So, ganito yung itsura niya. Prevent severe disease. Ito yung gusto natin na mangyari. Kahit na nagka-COVID ka, para siyang leyon na nakakapatay. Dito, para na lang siyang pusa. So, hindi na siya dangerous. Cute na lang siya. Tapos sa pangalawa, it prevents clinical disease. So, posible na meron tayong COVID, kaya lang nakakulong siya, kaya yung mga sintomas, hindi siya lumalabas. And then prevents transmission, hindi na siya kakalat sa iba. So, ang goal natin is magkaroon ng tinatawag na herd immunity. Ano yung herd immunity? Halimbawa ako to, so bibigyan ako ng bakuna. Ako mismo na poproteksyonan. Pero maproproteksyonan din yung mga tao na hindi pwedeng magbakuna. Halimbawa, yung mga bata, hindi pa sila pwedeng mabakunahan ng COVID-19 vaccine. Dahil yung virus, hindi na siya dadapo sa akin, hindi ko na siya makakalat sa ibang tao. Pero magiging epektibo lang ang tinatawag na herd immunity. Herd meaning collection of animals. Kung around 70 to 80% ng ating population ay bakunado o protektado na mula sa COVID-19. Paghambingin po natin ang mga bansa na nabakunahan laban sa COVID-19. So makikita natin yung Israel, very aggressive. Madami sa kanila mga tao, around 60% ang nabakunahan na. And tayo, nandito tayo sa baba. So kung mapapansin nyo, dahil nabakuna, ang isang dahilan, no, kay Israel, nabawasan talaga sila ng COVID is dahil dun sa bakuna. Samantalang tayo, kahit hindi ganyan kadami, no, is pataas ng pataas yung ating COVID incidents. Dahil dyan, tingnan nyo, so yung Israelis, hindi na sila kailangan mag-mask kasi bumaba na yung incidence of COVID. Nakatulong talaga yung pagbabakuna sa kanila. So, yung COVID-19 in development, no? Dati nung nagsimula, talagang talagang masugid yung pagsusuri, talagang mahigpit sila. Kasi nung nagsimula, madaming mga bakuna o formulation, madaming klase ng bakuna yung sinubukan nilang i-develop. Pero sinasala nila kada phase of the trial. So, halimbawa, from phase 1 to phase 3, nababawasan kung hindi na safe, konti na lang yung bakuna na approved. So, maaasahan natin na yung bakuna na aabot sa atin, isa lang sala na at approved kasi nadaanan nila ang testing sa mga hayop, healthy young individuals, iba't ibang mga klase ng tao. And gusto din natin i-test yung impact niya, may gana ba siya laban sa COVID-19. So, ito yung mga component ng vaccine. So, medyo challenging siya, no? Ang important lang na maalala is yung vaccine natin, meron siyang balat, meron siyang laman, yung tinatawag na DNA. Tapos, yung mga protein subunits, no? So, medyo complicated na to. But, suffice it to say na may iba-ibang components yung virus. Tapos, base dito, dun po may pili yung mga nagbabakuna kung alin dyan yung gagamitin nila. So, meron itong sa Novavax or sa Sanofi, yung protein subunit. Itong sa Medicago, parang yung balat yung tinatry nila gayahin. Yung sa Pfizer and Moderna, ito yung sinasabing DNA or RNA-based. So, kinuha naman nila yun nandun sa loob. Tapos, ito yung sa AstraZeneca is a non-replicating viral vector. So, ito lang yung kinokopy niya yung certain genes. Tapos, itong sa MSD, ganun din. Replicating viral vector naman, bahagi siya ng virus sa loob. And then, yung sa Sinovac is inactivated, buong virus pero patay, yun yung nakalagay sa loob. Tapos, live attenuated yung codogenics. So, yung sa atin, important sa Philippines is yung Sinovac, meron tayong AstraZeneca, Pfizer, and Moderna. So, ang mahalaga lang maalala dito is iba-iba silang klase pero lahat sila, hindi sila buhay na virus. So, ang kaligtasan sa pagbibigay ng COVID-19 vaccine, yun yung pinakamahalaga sa atin. So, COVID-19 vaccines are being held to the same safety standards as all vaccines. So, kung dati nabakunahan ka na ng BCG, HEPA, lahat ng pagsusuri na dinaanan ng ibang bakuna na binibigay sa atin commonly, nadaanan din yun ng COVID kahit na maikli lang yung panahon. So, before authorization o bago siya inilabas sa atin, ni-review siya ng Food and Drug Administration, ni-review lahat ng safety data, bago din siya magamit. Tapos, after authorization, minomonitor pa rin nila yung bakuna. Kaya kung mapansin nyo, kung nabakunahan na kayo ng COVID, kinukuha talaga nila lahat ng detalye, ine-emphasize nila na mag-report back kayo sa kanila kung meron tayong naramdaman na mga side effects na malala. Para mabantayan nila and ma-report nila sa mga kinauukulan kung dapat ba nang itigil na natin yung bakuna. So, meron din tayong tinatawag na emergency use authorization. So, ito ibig sabihin is yung FDA pinapayagan niya na yung mga grupo na may high risk for COVID-19 infection, sila talaga yung magbe-benefit or sila yung merong makukuhang benepisyo mula sa bakuna. Halimbawa, yung mga matatanda, sila yung prone na magkaroon ng COVID-19 vaccine tapos ay COVID-19 infection. So, kung mapapansin natin, yung mga na-o-hospital na delikado, yung mga matatanda. Tapos sila yung mas madali na magkaroon ng severe or critical and sila yung mas protection na natin kasi madali silang mawala sa atin dahil sa COVID. So, sila yung uunahin natin bigyan ng bakuna. So, they provide access to vaccines before long-term follow-up of studies that may address very remote risk. So, kahit na medyo hindi pa matagal yung bakuna sa atin, binibigay na yun sa kanila para maproteksyonan. Tapos, yung mga dating pag-aaral o yung tinatawag na trials, pinakita din ito sa mga targeted groups o dun sa mga high-risk groups na dapat may benepisyo sa kanila yung bakuna. So yung Food and Drug Administration can approve a promising candidate for those most at risk while continuing to collect data. So ang nangyayari is yung mga bakuna na nakuha natin na aprubahan na ng FDA, nakita kasi sa nakaraan na nagbigay siya ng benepisyo. Pero nagkokolekta pa rin sila ng mga datos para malaman natin sa mga darating na panahon kung ano yung best choice for each patient. So dito, sinummarize or binigyan ng kabuuang summary ng Philippine Society of Microbiology and Infectious Disease ang iba't ibang bakuna na available sa atin. So, iba-iba silang klase ng bakuna, tapos approved naman sila lahat ng FDA. Itong hindi approved, hindi naman binigay. Tapos ang bawat isa sa kanila ay 2 doses, iba-iba lang ang oras. Tapos, makikita natin dito na meron siyang tinatawag na vaccine efficacy, no? So, yung vaccine efficacy nila, mataas din, greater than 90%, with the exception of the exception of the Sinovac, so 50%, and then yung AstraZeneca, 70%. Pero yung aalalahanin natin dito, yung vaccine efficacy, so dito is yung vaccine efficacy is yung kakayahan niya na mag-prevent ng COVID. Pero yung gusto talaga natin is prevention of severe COVID-19. So, yung sa Moderna, medyo mataas siya. So, yung pinaka-importante na mga grupo na makakatanggap ng bakuna ay binigay ng Department of Health. So, currently, sa ngayon, ang Pilipinas, nandito tayo sa priority eligible A. So, yung A1, syempre nauuna yung healthcare worker and then senior citizens. Tapos, persons with comorbidities. Ang ibig sabihin nito ay ang mga tao na may sakit gaya ng hypertension, diabetes, or iba pa. Tapos, frontline personnel in essential sectors, including uniformed personnel, so yung mga militar, tapos yung mga hindi afford na makabili ng bakuna. Then, pag natapos na ito, mag-move on na tayo to priority eligible B. Ito yung mga exposed, and then the rest of the population. So, ito yung mga karaniwan naming natatanggap na mga katanungan tungkol sa COVID-19 vaccine. Number 1, pwede ba ako magkaroon ng COVID mula sa bakuna? So, hindi. Hindi. Dahil kung alalahanin natin nung ni-review natin kanina, wala namang buhay na COVID na nandun sa ringgilya or syringe. Maaaring mga pera-peraso lang silang bakuna o maaaring mga inactivated COVID virus sila. So, hindi. Hindi tayo maaaring makakuha ng COVID mula sa bakuna. So, pwedeng mangyari is kung may nabalitaan kayo nagkaroon ng COVID, maaaring nagkataon lang na nabakunahan siya, pero nahawa din siya at that time sa ibang tao na maaaring may COVID. So, baka hindi pa siya nakadevelop ng antibodies kaya siya nagkaroon ng COVID-19. So, ang nangyayari is, hopefully, pag hinintay natin makalipas ang panahon, nakadevelop na ang katawan natin ng panlaban or antibodies, magkakaroon na tayo ng immunity o protection mula dun sa COVID-19 virus. Ano ang common side effects ng bakuna? So, common, pwede tayo magkaroon ng pangingirot dun sa injection site, pwede tayo magkaroon ng pananakit ng ulo, lagnat, pananakit ng katawan. Pero pag natapos naman na itong side effects, magkakaroon na tayo ng immunity o panlaban sa COVID-19. Ngayon, yung isang side effect na very controversial recently is that nung nakaraan nung April, nagsuspend ang Department of Health ng paggamit ng AstraZeneca sa mga pasyente edad 60 years old pababa. Dahil nakita nila na mas mataas yung chance na magkaroon ng stroke. So, or blood clots. So, ano bang alam natin tungkol sa blood clots? So, blood clots, nangyayari yan sa pasyente na may stroke, pag nagbara yung ugat sa utak, nagkakaroon tayo ng sakit sa paa o sa braso kung ang ugat na nabarahan ay nandoon. Tapos, sa European Medicines Agency, sinasabi nila na ang blood clots and low blood platelet, yun ay immune response leading to a condition seen when patients are treated with heparin. So, ito yung alam natin tungkol sa pagbabara. So, nagkakaroon ng buong dugo na bumabara sa ating daanan ng dugo. Ngayon, hindi talaga malinaw kung nangyari yon dahil dun sa bakuna. Tapos, inilabas ng Department of Health ang kanilang check the FAQs or frequently asked questions kung saan nakita natin na totoo nga naman na merong 4 sa 1 milyon na nabakunahan sa AstraZeneca na maaaring magkaroon ng pagbara sa ugat, pero mas mababa pa rin ang risk na ito ng blood clot sa mga naninigarilyo, naglalakbay sa eroplano, o gumagamit ng pills. So the risk of getting a blood clot if you're a smoker, a frequent airline traveler, and contraceptive pill, higher pa rin siya ng AstraZeneca. Pero, kung ihahambing natin siya, kung hindi ka nagpabakuna, mas mataas yung chance pa rin na maa-admit tayo sa ICU. So, dito sa table na to, nakikita natin across different age groups o sa edad na iba-iba, yung mga bilog na to is bilang na mga pasyente na na-admit sa ICU ng COVID-19 kada 16 na linggo. So kung titingnan nyo, pag nabakunahan ka, yung potential safety, less than 1 patient per group ang ma-admit sa ICU. Pero pag walang bakuna, lalo na dun sa mga ating lolo, lola, or parents, 41 patients ang admitted in the ICU every 16 weeks. So kung maaalala natin yung surge nung April, wala na tayong mapuntahang ospital kasi punong-puno na ng COVID severe and critical. So kung ating iisipin yung risk ng getting a blood clot from the AstraZeneca or the other vaccines, mababa pa rin siya. Susukatin natin ano yung mas gusto natin na benefit, no? So, hindi magka-blood clot, 4 in 1 million, or hindi magka-COVID critical and severe. Next question. Pagkatapos ko makuha ang bakuna, magpa-positive ba ako sa swab? So, hindi. No. Vaccine does not contain a live virus. So, pag nag-swab tayo, hindi magpa-positive. Ang goal natin is magkaroon ng antibodies or panlaban. So, sa COVID-19 antibody test, dun tayo magpa-positive. Pero hindi ibig sabihin nagkaroon tayo ng COVID-19. Ang ibig sabihin nito, nagkaroon na tayo ng madaming panlaban laban sa COVID-19. I had a previous COVID infection. Dati nagka-COVID ako. Pwede ba ako magpabakuna? Yes. So, kahit nagkaroon ka ng COVID-19 infection before, pwede ka pa rin magpabakuna for protection. Kasi, pag nakita nila na yung dating antibodies laban sa COVID-19 pag-infection, bumababa siya. So, kailangan natin ng booster or support. So, dito, ang mahalaga is that ang time frame from COVID recovery is 2 weeks, pwede na tayong magpabakuna. Hindi na kailangan yung dating sinabi na 90 days. So kung nagkaroon ka ng COVID, gumaling ka, intay ka lang ng 2 linggo, pwede ka na magpabakuna ulit. Next, meron ako mga iniinom na gamot na nakakapagpanghina ng aking immune system. So ang mga halimbawa nito is prednisone, hydrocortisone, steroids, or immunosuppressants. Pwede pa rin ba ako magpabakuna? Yes, pwede pa rin. So wala tayong makitang mga datos tungkol sa paggana ng bakuna kung nakagamot tayo laban sa immune system. May chance na hindi masyadong maging magaling yung ating immune system at hindi dumami ang ating antibodies. Kaya kailangan ng patuloy na pag-o-observe sa ating mga patients. So kausapin natin yung ating doktor. So ang pagbabakuna ay isang paraan para maiwasan ang pandemya. So habang ang COVID-19 mRNA vaccine, so ito yung Pfizer and Moderna, sila ay epektibo, kailangan pa rin nating gamitin ang iba nating natutunang paraan para maiwasan ang COVID-19 vaccine. So ang gagawin natin sana ay ang pagbabakuna, pagtakip ng ating ilong at ng bibig with a face mask and face shield, social distancing of 6 feet, o kaya 1 to 2 meters or may pagitan ng isang buong lechon sa pagitan ng 2 tao. Iwasan ang madaming tao, tas yung mga kulob na lugar, tas laging maghugas ng kamay. So, Para sa pandemic, ginagamit natin ang tinatawag na Swiss cheese respiratory virus pandemic defense. Kung papansinin niyo yung Swiss cheese, madami siya mga butas-butas. So, kailangan gagawin natin lahat para hindi makalusot yung COVID-19. Habang dumadami yung intervention natin o yung pag-iwas natin sa COVID-19, hindi naman kasi lahat sila perfecto, pwedeng makalusot yung COVID. Pero habang dinadamihan natin yung ginagawa natin, para maproteksyonan ng sarili natin mula sa COVID-19, mas magiging matagumpay ang ating paglaban sa pandemya. So ang mga ito again ay physical distancing, manatili sa isang area na magandang ikot ng hangin, pagsuot ng face mask, paghugas ng kamay, paglinis ng ating kapaligiran, contact tracing, testing kung meron tayong suspicion na tayo may COVID. Kung tayo may COVID is magpa-quarantine and isolate. Tulungan yung ating gobyerno. And yung business sector natin, yung tulungan din tayo sa pagbabakuna. So yan ang lahat yan sana pwede natin gawin para mapuksa natin ang ating pandemya. So meron din tayong tinatawag na community security model. So dito, dapat lahat to ginagawa natin siya. So magsisimula tayo sa bahay, saan may social distancing, proper ventilation, mask and personal protective equipment, tas hand hygiene and surface cleaning. Tas paglabas natin, magpapabakuna, quarantine and isolation kung meron. Tapos sana matulungan tayo ng ating gobyerno in financial support, tracing and testing para malabanan natin yung COVID-19. So, kailangan sana natin malabanan yung COVID kasi mahigit ng 2 milyon ang napatay niya. Tapos, lumikha siya ng bilyong-bilyong pagkalugi at kawalan ng hanap buhay. So, magpasa hanggang ngayon, nakikita pa rin natin ang epekto ng COVID-19. So, kailangan talaga natin ito maipuksa para matapos na ang lagim na naidulot niya sa ating sambayanan. So, is it worth a shot? To me, yes. Sana sa inyo din kasi binibigyan na tayo ng pagkakataon na makapagpabakuna. So, always for us to remember, pag nagpabakuna tayo, ito na yung simula ng pagbalik ng ating community to our previous state. Sana dumating na ulit yung panahon na pwede na natin hawakan yung isa't isa, magyakapan at maging kasama yung ating mga relatives. Ito yung iiwan ko po sa inyo na sinabi ng ating isang mga important doctors in the Philippines, si Dr. Angeles Tan Alora. She is an infectious disease specialist. Sabi niya, magpapabakuna daw siya. But in the meantime, I will continue to the effective public health measures to prevent the spread of COVID-19. I will stay 1 meter away from others, choose well-ventilated spaces, wear a mask, wash my hands, disinfect, cover my nose and mouth when coughing or sneezing, and isolate the sick. I will also pray hard for wise, service-oriented, and courageous leaders. So gaya ng sinabi niya, yan din yung mga kaya nating gawin. So let us all do our share to help out. So thank you very much, and immunization save lives. Please know it and share it. Good day, and we will be open to answering questions. Kung meron po kayo mga katanungan, pakitype lang po sa chat.
Thank you very, 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 very much, Doc Lim. That was a very informative talk. And we already have a lot of questions from the audience coming from YouTube, our Facebook page. So I hope we have enough time to answer it, Doc Lim. So here we go. So one of the questions comes from Edmund Samonte from our Facebook page. And the question of Edmund is, if we get vaccinated, are we not allowed to go outside after vaccination, and for how long?
Okay. So on vaccination, you're not restricted or hindi naman ipinagbabawal na lumabas pagkatapos. Pero sa kakanasan ko po or from my experience, I found that after the first vaccine, I had side effects. I experienced side effects. So, dahil nauna na po yung iba kong kaibigan na nagpabakuna, nabigyan nila ako ng warning and I actually took a work leave the day after. So, kasi yung for myself, grabe po yung naging side effects for me. So, nagkaroon po ako ng body pain and fever. So hindi naman bawal lumabas, pero as a friendly advice from a person vaccinated, yung recommendation ko pa is the day after probably take some time to rest kasi yung immune system nyo po, gagana siya, mag-overdrive siya at ma-excite siya to build your antibodies against COVID. So, walang araw, walang bilang ng araw na kailangan mamahinga, pero baka okay na mag-leave 24 to 48 hours para kung meron tayong side effects, hindi tayo mahuli habang nasa trabaho.
Thank you, Doc Lim. Usually, will we feel that on the first shot or on the second shot or both?
So I have not yet had the benefit of getting the second shot. Many of my colleagues who received the yung iba kasi sa Sinovac, this is experiential, no, not based on the studies. So for my friends who have received the Sinovac vaccine, hindi masyadong intense yung side effects. For those who have received the Astra, mas intense yung side effects. And for those who have received the first and the second shot, they also experience the side effects during the second shot. So for both.
So, Doc Lim, are these side effects? Are they minor side effects? What kind of side effects so that the audience would know? Bakit sila sa word ng side effects eh?
Okay, they can be pretty varied. So, yung iba wala talagang naramdaman. So, they were able to go on with their work as normal. Yung iba nagkaroon sila ng cold. So, for me, it was a low-grade fever. So, CNAT lang. Yung temperature is less than 37.8. And para sa akin, yung, syempre, pain on the vaccine site, yun yung pinaka-common kasi naturukan tayo doon. But the worst, I think, was yung general body pain. Nagkaroon talaga ako ng pakiramdam na para akong tinatrangkaso. So, maaari tayong mag-take ng supportive painkiller medication like paracetamol, etc.
Okay. All right. Thank you, Doc Lim. We have another question. This is from our PSSI Facebook. Can the COVID vaccine, especially Moderna vaccine, affect a woman's period? Some women say that it changes theirs to heavy flows after the first shot. So I think this person is worried about maybe fertility or how if it will affect them if they take the vaccine.
Okay, so my first disclaimer is I'm not an infectious disease specialist. I'm an internist. And based on my reading, I have not come across any effect on the period for the Moderna vaccine. But I will need to read up on that and send the verified answer to our friends in Pacific. But based on my readings, I have not seen any association with the vaccine and the period.
Okay, thank you. And we'll post the answers in on our Facebook. Next question is, I'm 45 years old. I take maintenance for high blood. What vaccine will you recommend for me that is available now? This is from our Facebook page from Lizelle Beer.
So, so part po kayo ng A1 population and I echo the words of Dr. Fauci, who is an infectious disease specialist in the United States. So he says that the best vaccine is the vaccine that is offered to you. So kung ito na yung nabigay, ang goal natin is mabakunahan agad-agad. So in that way, in terms of vaccine goals, yung prevention po ng severe and critical COVID, all the vaccines that are currently released, ang lahat po ng bakuna na nailabas ay merong efficacy against yung severe and critical COVID. So, any vaccine that is offered to you is the best vaccine.
Okay, thank you. And this is from one of our own at Pacific, from Christine Fernandez Jimenez. Need pa ba mag-mask and face shield if fully vaccinated na?
Yes. So, dun po sa table ng Philippine Society of Microbiology and Infectious Disease, nakita po na iba-iba yung tinatawag na efficacy ng bawat vaccine. Kaya lang sa mga pag-aaral, iba-iba po yung panahon na sila'y pinag-aralan. Kaya hindi tayo naniniwala na 100% sure yun. It is an estimate. So again, I will repeat, vaccine efficacy means ang capacity or ang kakayahan ng bawat bakuna na iwasan magkaroon ng COVID-19. So this is COVID-19 mild and moderate until severe. So uulitin natin, dalawa yung goals kasi pwedeng iwasan ng COVID or iwasan ang COVID severe and critical. Ang lahat ng bakuna, kayang-kaya niyang proteksyonan laban sa COVID severe and critical, pero iba-iba ang kakayahan ng bawat bakuna na mag-protect from COVID mild. So posible na magkaroon pa rin tayo ng mild COVID, kaya ang gusto pa rin natin kahit mabakunahan na ay magsuot pa rin ng mask, face shield. So yung mask, kailangan nakatakip po yung ilong tsaka yung bibig. Yung face shield, paghuhugas ng kamay and social distancing. Ang dahilan po dito is that ang bakuna ay magiging malaki ang protection kung meron tayong tinatawag na herd immunity. Ibig sabihin nun, kailangan 70 to 80% ng population or in the case of the Philippines, 70 to 80 million po na mga individual na mga Pilipino ang kailangan mabakunahan. So nasa simula pa lang tayo, wala pa tayo dun sa 70 million na nabakunahan. So tas hindi mo alam kung yung katabi mo bakunado siya o hindi. Kaya kailangan itutuloy pa rin natin yung social distancing and barrier method. So yun ulit yung mask, face shield, yung hand washing, tsaka social distancing. Yun yung pinakita natin sa Swiss cheese method. Kailangan lahat ng paraan para proteksyonan ang COVID, ginagawa natin. So ang nagiging malaking misconception o maling pag-iisip ay pag nabakunahan tayo, pwede na tayo bumalik sa dati. Hindi yun totoo. Kailangan pandagdag siya dun sa mga natutunan natin from 2020 and 2021.
So we really need to encourage others to get vaccinated so we can reach herd immunity then.
Yes.
Because if we don't reach herd immunity, even though we've been vaccinated, we still need to follow the health protocols against COVID. But I hope we can reach herd immunity soon. I hope we can. We have another question.
I hope so too.
Yeah, I hope so soon. We have another question also from one of our employees. Hi, Doc. Meron po bang preparation we need to do or undergo with our body prior to the day of vaccination? So do they need to do anything before getting their shot?
So normally kailangan lang na kung kunwari meron kayong medication na inom natin yun, wag natin siya lalaktawan. And possibly, syempre, yung sa bakuna, maganda din yung nakaligo or para malinis yung vaccine site. Pero other than that, wala namang special na kailangan. Ang common na nakita ko dun sa karanasan sa mga vaccine sites ay nagkakaroon ng hypertensive episode. Syempre kasi kinakabahan tayo dun sa pagbabakuna. So, ang recommendation ko po is para dun sa mga pasyente na may high blood, dapat nakainom sila ng kanilang maintenance medication, and kung meron sila ng mga as needed medication, pwede nilang baunin yun sa vaccine site.
Okay. So we have a question from Marissa Marfil from our Facebook page. How true is it that even though you were given Sinovac vaccine, you are still a carrier of COVID? Therefore, you can still give someone else COVID?
So the question is unclear to me if like you had COVID at the time that you were vaccinated. Is it a COVID infection or is it carrier because you were vaccinated? So I'll answer them both. So yung first scenario is pwede ka maging COVID carrier. Halimbawa kung na-infectionan ka ng COVID, tas nabakunahan ka. So, syempre, merong panahon na yung katawan mo, kailangan niya mag-produce ng antibodies o panlaban. So, sa kasong yun, pwede ka pa rin maging carrier. Ibig sabihin, kumbaga ako, kotse ako, hindi ko pa nalock yung pinto, hindi pa ako nakapagpabakuna, nakasakay na yung COVID, tapos saka ako nabakunahan, pwede pa rin ako maging carrier. Kung yung question ay kung maaaring maging COVID carrier dala nung inactivated vaccine, yun yung hindi. Kasi patay na yung virus na ibibigay sa Sinovac, hindi siya buhay. So in that case, hindi ka pwede maging live COVID virus carrier. I
Okay.
hope I was able to answer your question. Kung may clarificatory one, just send a follow-up. And Deliza, I did a quick search regarding the previous question on Moderna and period. So in the literature search, walang lumabas na correlation between the Moderna vaccination and the strength of the period as far as my medical search went. So we'll stand by and wait for that one.
Thanks, Doc Lim. Okay, another one is, this is from Francisca Meharan from our YouTube. May tanong po ako, pwede po ba magpabakuna kapag po menopausal na pero bumalik po yung menstruation, wala po maging effect yan? Oh, it's another question related to women's health.
All right. So I think she's asking, confirm if it's correct. Pwede po ba ako magpabakuna kung ako'y menopausal na, nawala ang period and bumalik ulit? Yes, pwede tayo magpabakuna. So I didn't get your age. Pero kung menopausal and above 60 years old, actually you're part of the A1 group. A2 group. So priority yun. So far sa women's health and dun sa pagbabakuna, walang bawal. Wala naman tayong pinagbabawalan dun sa bakuna kung hindi nagkakaroon tayo dapat ng longer monitoring time dun sa mga patients na may allergy. So in terms of menopause, hindi po siya bawal, lalo na kung aalalahanin natin yung A2 population or yung matataas yung priority senior citizens. And if we recall, menopausal naman po yung mga kababaihan above 60 at hindi bawal. So, hindi bawal.
We have another question, which is, what if you don't know if we have existing allergies or disease? So they don't know. Can they be vaccinated right away, or should they consult with a doctor first or have a checkup? Maybe they have some doubt.
Okay. So actually, yung mga merong sakit, sila yung mas dapat mapabakunahan kasi sila yung mas mataas yung chance na ma-infection na ng COVID at sila yung mas mataas na chance na yung infection ay magiging malala o critical. So, I think hindi bawal magpabakuna pero kailangan pa rin natin sumangguni sa doktor dahil ang pagkakaalam kung tayo ay may sakit, syempre mahalaga siya maliban sa COVID. Hindi siya related to COVID at all. Parang it's related to your health. So I think a proper doctor's consult is good. Maybe hindi siya kailangan para magpabakuna, pero makakatulong siya kasi halimbawa malaman natin na meron ka palang high blood, kung kunwari tumaas yung blood pressure mo sa vaccine site, at least ready tayo o handa yung mga gamot o yung mga kailangan gawin based on your illness.
Wow, we have a lot of questions here. Maybe we can do another 3 to 5 minutes to answer some of them. We have a lot of questions, Doc Lim. One is from Ronald Yap. I know him. From our Phil Steno YouTube page. Pwede po magpa-vaccine ang taong may stroke? So can you get a vaccine if you have a stroke? If you had a stroke? Doc Lim, can you hear us? Okay, I think Doc Lim is having some technical difficulty right now. Maybe we can wait to get her back. In the meantime, if you have doubt or health issues, consult with your doctor if you can get vaccinated. So like one of the questions earlier, if you had allergies or anything. If you feel you have doubt, consult your doctor if you can get vaccinated.
Hi. I'm sorry I got lost. Okay, but I'm back.
Glad you're back. We have, Doc Lim, we've got a lot of questions here. Maybe what we can do is the rest of the questions that we have that are unanswered, we can put it maybe on the Facebook page, and maybe you can answer them when you have a little bit of time. But the last question was, can we vaccinate, pwede magpa-vaccine ang taong may stroke?
All right.
Did you hear that, Doc? Can someone who has had a
Yes.
stroke get vaccinated?
Yes. So, yung stroke po na vaccine, stroke patient, pwede siya. Pero syempre, kailangan natin i-differentiate kung siya ay acute stroke or chronic stroke. Matagal na ba o bago lang? Kung bago lang siya, mga less than 6 weeks, I recommend na magpatingin kayo sa doktor kasi yung COVID mismo, pwede siya mag-present as stroke. Pero kung matagal na, pwede naman.
Okay.
So, I'm afraid I wasn't able to include it in the slide, but the Department of Health has a statement regarding yung pre-vaccine preparation. Maybe I can just send it over to Pacific and our colleagues, and then you can post it. For the questions, if you're interested to have another live session, we can do that. Or maybe I can just answer the questions once they are sent to me.
Yeah, because wow, I didn't expect to have a lot of questions from maybe we'll take the last 3 questions. The last,
All right.
last 3 questions. Can a kidney donor be vaccinated? This is from our Facebook page from Christian. Pwede po ba magpa-vaccinate
Yes.
ang kidney donor? Okay.
Yes. So, i-emphasize ko na lang kung sino yung kailangan magpatingin sa doktor. Ang kailangan magpatingin sa doktor bago sa pagbabakuna is maybe yung may allergy and also yung naka-immunosuppressive medication. Yung mga cancer patients na nagki-chemotherapy, sila yung kailangan ng medical certificate bago. Yung iba, hindi. Pero yung vaccine sites nang hihingi pa rin kung may comorbid. So, you can ask from your doctor. So, kidney donor, yes, pwede magpabakuna.
Okay. And then, say for example, you had COVID. So this is from PJ from our YouTube page. Hello, Doctor. Ask ko lang po, after po magka-COVID and mag-recover, ilang months po bago pwede magpa-vaccine?
2 linggo from time of recovery. So pag uwi nyo, yung infection control, may sinasabi silang date na until this time kailangan quarantine. So after that date, bilang ka ng 14 days, pwede na ulit.
Okay. Oh, last 2 na lang, last 2. I know I said 3, but let's add another 2.
It's okay.
My mother, who is 47 years old, this is from our Facebook page from Annalyn. Hi, Annalyn. My mother, who is 74 years old, had already her first dose vaccine, but the rest of the household members are not yet vaccinated. How high is the risk that she will be infected by COVID? She is also exposed to different people because she has a dress shop business. So,
this is for mom, yung
Yeah.
risk of exposure ni mom.
Mom is already 74, already had the first dose of vaccine, but is exposed to a lot of household members and also people at her dress shop. So, if
Right.
she
Did she mention Sinovac vaccine?
She didn't say what brand the vaccine was.
Alright. So, dun sa table na ni-review natin, base dun sa datos, iba-iba yung efficacy ng vaccine na mag-protection laban sa COVID. So, nag-range siya from 50 to 90% depending dun sa bakuna. Pero, pag ipinasok mo dun yung face mask and face shield, at all times na may exposure, ang risk of infection just goes down to less than 10%. So, hindi lang yung bakuna yung important, yung face mask and face shield pa rin. So, normally, ang ina-advise ko sa patient, pag parehas na naka-face mask and face shield, less than 10% na lang talaga yung chance of infection. In terms of the vaccine, tingnan nyo lang yung column on the vaccine efficacy. So, nag-range siya ng 50% for Sinovac, 70% for Astra, and above 90% for Moderna and Pfizer. Based dun sa studies, hindi yun guaranteed. Pero base dun sa datos na meron tayo, yun yung sinabi ng mga eksperto natin.
So the mother at least has some protection from the first dose and then continue to follow the health protocols for 74-year-old nanay and also have the people around her using the same health protocols to prevent COVID. Okay.
Yes, that's correct.
And then another question from Walter from our YouTube channel. Is the first and second dose, should it be the same brand?
Yung studies kasi rely on the first and the second dose having the same brand, but there are ongoing studies regarding vaccine hopping. But we still have to wait for the results of those.
Vaccine hopping. Okay, and my first
It's
time
not,
to hear that.
that's not the scientific term, pero yung halimbawa, Sinovac ka, tapos lumipat ka sa Pfizer. So, ongoing pa yung studies. Wala pa masyadong definitive data about this. So, we'll just stand by for the next few months.
And I think with the LGU, if you get from that particular LGU, especially that particular vaccination center, you're supposed to get your second dose from there as well.
Correct. Yeah. So, alalahanin po natin pag nagpabakuna kayo saan man, pag nag-start kayo nung first, automatic yung second kasama na siya.
Right. Okay, this is the last question. I'm sorry to the others, but we trying to keep it within the hour or 6 minutes over time. But Doc Lim will get to those other questions on our Facebook for those that are unanswered. Last question of the morning. What is the best statement to tell a friend who is really anti-vaccine? Thank you, Ayla Torrevillas. Thank you very much for that question. So what is the best statement to tell a friend who is anti-vax? How do we convince?
The sad truth is, the sad truth. So I'm not anti-vax, obviously. I just like to share my background. So I've been seeing COVID patients since March 2020, and my practice has been heavily COVID, and I've seen a lot of the damage it can do. So I'm not an anti-vaxxer. Initially, I tried to convince a lot of people to get the vaccine until I got the vaccine myself. So getting the vaccine and dealing with the side effects was also not easy. So I realized that, people have their own convictions, and I don't force people to get the vaccine. Kasi kung may side effect is may mangyari, it's very difficult. But what I just do is I present the data. So like today, I just presented the data kung paano tayo nag-ingat sa pagbabakuna. So in summary, maybe what I tell an anti-vaxxer is, yes, vaccines have their limits, but always remember that when you get it, you don't just protect yourself. We're one step closer to protecting the Philippines. That's what I say. So, but we don't, we don't try to convince them personally, but we try to convince them for the greater good. So that's what I say.
Wow. That's awesome. That's an awesome last statement from you, Dr. Lim. Now, don't just protect yourself, but protect the Philippines.
Yeah, but it's a positive way of really saying I will be a bit mean, no? Parang gusto ko sabihin, wag mo naman sarili mo lang isipin mo. Isipin mo lahat ng tao. So that's what the vaccine, for me, that's what the vaccine means.
Yeah. Do it for your protection. Do it for your family's protection. Do it to help get our economy started.
Yeah.
The pandemic has caused our economy to suffer. We are in a recession right now. In case some of you are not aware, we are definitely in a recession right now. And even our OFWs, our heroes that send us money, they've been greatly affected. Some of them have been sent back home. They don't have jobs. It's less money for our economy. So like what Dr. Lim said, many jobs have been affected and even lost. A lot of jobs have been lost. Let's get back on track and let's help our economy get on track by vaccinating, so that your colleagues and your clients can feel confident that they are safe against COVID from you.
Yeah.
So we need to build confidence. We really need this confidence amongst each other that we're safe, and also to get our economy up again. So we've got to end. We'd like to thank Dr. Lim, and we'd like to present this e-certificate of appreciation for your valuable contribution as our speaker and answering all of those questions. Thank you, Dr. Lim, for sharing your time with us this morning. So thank you so much, Doc Lim.
And thank you also for the opportunity.
Yeah. No, it's our pleasure. Thank you so much. And we hope that with this effort, we can increase vaccine willingness to help ourselves, to help our loved ones, and to help our economy. And for today's winners, we have winners, Doc Lim, from our question and answer. So congratulations to, let's see who's won the 200 pesos. Giselle Pardilia, who was on our Phil Steno page. Congratulations. You won 200 pesos in GCash. And our next winner is, spin that wheel. And who is it? Ronald Yap. Oi, Ronald Yap. I know you. You're from Pacific. Congratulations. You won 200 pesos GCash. And our next winner for today? Let's see. Let's spin. This is real, huh? It's automatic. So Reggie Ocampo. I'm not sure which company you're from, but congratulations, Reggie Ocampo. You won 200 pesos GCash. Thank you for attending this morning. And then the next winner, Pia Beltran. Pia Beltran was on our FB page. Thank you, Pia, for your question. I know you. You're from Pacific. And next winner, did we do already 5 winners? Let's see. Okay. One more. Ray Salazar. Congratulations, Ray Salazar. You won 200 pesos GCash. Ray, I'm not sure what company you're from, but congratulations and thank you for joining us this morning. And I hope that you and your colleagues can help protect yourselves, your family, and our economy. Okay, so Angelica will contact all the winners on how to claim your prize. So that's all the time we have left for this morning's webinar. In case you want to review, we will surely share it on our Facebook and YouTube channels. And those unanswered questions, maybe we can ask Doc Lim to maybe answer them as well. And we'll also post those in the comment section of our YouTube and Facebook channels. So please do your part in helping the economy. Please do your part in protecting. In protecting yourself and in protecting your family. Please do your part in protecting yourself and others before it's too late. Don't let COVID get you. You attack COVID before it attacks you. And it's, as Dr. Lim said earlier, she said, protect yourself, protect the Philippines. Do your part in helping. Please stay safe and vaccinate. On behalf of Pacific Sun Solutions and on behalf of Pacific Office Solutions, we thank you all for joining us this morning. Thank you and happy weekend.